Schizophrenia is a chronic disabling brain disorder that affects 1% of Americans. It occurs at similar rates for all ethnic groups and men and women equally. Individuals with schizophrenia may experience a number of symptoms that affects their thinking. Schizophrenic clients have trouble organizing their thoughts and deal constantly with a racing mind. They may also experience hearing voices, seeing imaginary sights, believing people are reading their minds, or plotting to harm them. Schizophrenia also affects individuals' behaviors, causing them to speak incoherently, make up words, and appear agitated. This causes schizophrenic clients to have trouble maintaining relationships and even their basic hygiene. However, medication adherence is extremely important for people living with schizophrenia because it reduces the risk of relapse, long-term hospitalization, and improves the quality of life and functioning. Non-adherence in patients with schizophrenia is a subject of concern because it occurs frequently and contributes to a substantial worsening of the disease and increased healthcare costs. This indicates that educating patients with schizophrenia is a challenge for nurses and healthcare in general. The most frequently reported reasons for patient dissatisfaction with medication include drug side effects, lack of involvement in treatment, planning or decision making, and lack of involvement of family members in the care plan. Therefore, educating a patient with schizophrenia about their medication is imperative to the overall improvement of their symptoms and could possibly ensure adherence to the medication. However, adequately and uniquely providing care, education, and building trust and rapport in schizophrenic patients is a challenge for nurses and other healthcare providers. There are a couple of barriers that are present that sometimes may prevent nurses and other healthcare team members from providing adequate and unique care to schizophrenic patients. One barrier is time constraints. To properly educate and collaborate with the schizophrenic patient on their medication takes time that some healthcare professionals just do not have. This barrier restricts significant amounts of information given to the patient, such as education on adverse effects of their medications. This barrier further prevents the nurse or physician from including the patient in choosing the treatment plan that best fits their specific lifestyle or beliefs. This could leave the patient feelings of distrust for their provider and confusion about their medication. One other barrier present is research and education. In order for the nurse to uniquely and properly educate his or her patient on their medication and schizophrenia, the nurse must have a knowledge base of antipsychotics and possible teaching techniques for the schizophrenic client. Without using evidence-based practice, the healthcare provider or nurse cannot adequately teach and include their client on treatment possibilities. This barrier is a disadvantage for the nurse and the client because it limits the nurse and the physician on treatment opportunities and deprives the patient of quality care. According to the article, Improving Treatment Adherence in Your Patients with Schizophrenia, a study showed that patients who form good therapeutic relationships within the first 6 months of treatment were significantly more likely to adhere to their prescribed medication and attain better outcomes after 2 years compared with patients with poor therapeutic relationships. By utilizing research, a nurse can learn new teaching techniques used in educating schizophrenia patients. One technique is using open-ended, non-judgmental questions about medication adherence. Questions based on the attitudes towards their medication and questions related to forgetting their medications. For example, by asking the patient if they think taking their medication over a long period of time is harmful to them. The nurse can then understand how the patient feels about long-term treatment and possibly educate them on how the medication actually works. One approach to overcome the barrier of time constraints is organization and an individualized plan to deliver care to patients. After the nurse finishes reporting at the beginning of a shift, he or she should then prioritize the care according to the importance of the condition. If the nurse has a patient that is going to take some time to educate or treat, for example, a schizophrenic client, he or she should then leave extra time for this particular client because they require more responsiveness. All clients require adequate care. The nurse must be able to provide this care in a timely manner. Nurses have the responsibility of researching and using evidence-based practice when providing care. Before education even begins, the nurse should first find out exactly what their client needs education on, whether it be medications, side effects to medications, or their disorder. Giving the patient the opportunity to voice their opinion about their treatment makes the patient feel as if the healthcare provider actually cares about them and their disorder. Once a nurse discovers exactly what problems the client has about their medication, he or she then can tailor their treatment to better fit the client. By doing this, it increases the chance of medication adherence because the patient had a say on what type of therapy they would want to be on. The challenges nurses face to educate and provide care to schizophrenic patients can sometimes be difficult because the disorder is so complicated and complex. Each individual affected by the disorder handles it differently. Therefore, it is the nurse's job to uniquely plan care for the schizophrenic client. The main barrier to overcome is researching and learning new techniques that could possibly aid in educating the schizophrenic client on medication adherence and their disorder. Medication adherence is one of the #1 reasons for relapse in schizophrenic patients because of the lack of education given to the client. This process of teaching and providing care to the client is not easy nor is it short. However, by taking the necessary steps to recognize the knowledge deficit of a client with schizophrenia, you can then apprehend how much and what type of education the client needs. Schizophrenia can be a hard disorder to understand and an even harder disorder to live with, but with patience and an attentive ear to listen to your patient, you could possibly improve their life.